As the landscape of healthcare evolves, how can optometrists stay at the forefront of innovation to provide the best possible eye health for their patients? From expanding access to care in remote communities to leveraging artificial intelligence for earlier disease detection, the tools of the trade are becoming more powerful than ever. Today, we're joined by Catherine Mahe from New Look Vision to explore the future of the profession. We'll discuss their pioneering work in remote optometry and how a supportive, team-based culture is key to delivering exceptional patient care in the modern era.
You guys have quite the remarkable story going from a single location in Quebec to the largest optical group in Canada.
So if the patients are really happy in the store, they will always come back. They will tell their friends, they will tell their families. Name one of the Canada best managed company. The culture, it's the main thing. Work as a team. Don't be individual, work as a team. So we are really using the latest technology, and it's extremely accurate. All of the lenses are made in Montreal in Canada, which is super important for us. We are a Canadian company. I started as an optician within New Look. I became assistant store manager. I became store manager, district manager, and now I am regional manager. We really try to develop our talents to be the best they can be.
So, Catherine, you started your career as a practicing optician before moving into the leadership role. From your, in the trenches perspective, what are the biggest challenges facing the healthcare professionals, the optometrists, the opticians who want to run their own practice today?
So the biggest challenge is competing financially against corporate optometry. Also, if you run your own practice, the cost of goods will be higher. You have to manage the business. In corporate optometry, the financial resources are more available, and you can really it will be more easier basically to work for a corporate company at the moment, I believe.
Okay, gotcha. And then, to work for a company, you guys are doing the contractor model with all of your staff, right? Or at least for the optometrists, is that right?
Yes, for the optometrists work in our store are a contractor, yes.
So for any of the optometrists listening, what does that actually mean for their day-to-day practice versus other corporate environments?
So basically, because I work as a contractor, they have full autonomy. They can manage the way they want to implement the healthcare they want for patients.
Mm-hmm.
They are only responsible for their college fees and liability insurance, but all the other financial responsibilities are done by the company.
Okay, amazing. And then you mentioned again in the green room ahead of time, it was quite a low overhead working with you guys. And then daily minimum guarantees on top of that. How does your guys' model provide the financial security, especially for new graduates?
So for all the optometrists, obviously new graduate included, the optometrists got a guarantee per day. So they know exactly the minimum amount of money they will earn every day. So obviously, thanks to that, they have financial security because they know exactly what they will make per month minimum.
And then how does it tend to compare to other options in the space then? Do they wind up doing better overall because of the guarantees and the minimums and the workflows, or what's the general sense?
I think the general sense is they really focus on patients' care. That's what we want. We want them to focus on the care of the patients. We don't want them to stress about money, to stress about anything else. That's what is great with us. The optometrist really is the main focus. It's the patient's care.
Okay, so it really is like turnkey practice. They don't have to worry about any of the admin, the financial side of things, all the clinical operations. It really just is that patient care focus.
Exactly. That's the most important for us. Optometrists, for us, it's really patient's care.
What about the in-clinic sales, the glasses sales, contact lenses? Is that anything that they have to be worrying about?
They don't really have to be worrying about. Obviously, they're part of it because they do the prescription. But it's, what I mean? It's not part of their job to check the sale, to check if we are doing well. Obviously, they are kept informed by the manager, but it's not the main priority for us. I think it's important for them, it's the financial stability. It's on the freedom as well. Like you said, they don't have any really admin to do. So that's a good thing for the contractors. They are contractors. They come to take care of the patients. We are doing all the admins, they have staff to help them. So I think that's really important.
What kind of state-of-the-art technologies, diagnostics could an optometrist expect to find in the clinics?
So we have obviously fundus camera with OCT. We have autorefractor keratometer, non-contact tonometer, and visual field headset. So we've got all the equipment for optometrists to be able to do a full eye exam.
Comparing to the other clinics that are out there, what would be some of the day-to-day differences that your optometrists and opticians might actually find in the technology?
So for optometrists, is what I say, we've got really all the machine needed to do a full eye exam. For optician, we are using tablets to take measurement now. So we are doing a full facial scan of the patient. To take the measurement on the frame, we are doing frame scan. So we are really using the latest technology, and it's extremely accurate. So with all those scans, we can make sure that the glasses will be totally accurate as well. We have to refer if it's referral to ophthalmologist, but otherwise we can check everything in store.
And then you guys were the first in Canada to enable remote optometry. Tell me a little bit more about that. That sounds cool.
So remote optometry is super cool. So basically we are using it in most areas that we are struggling to find optometrists sometimes. So what's happening, we have a technician in store who are going to perform all the pre-test for the optometrist. The patient will see the technician on the optometrist via camera. So they will be sit down in a chair. The technician from Digital Optometrics will have access remotely to do the site test. And then the optometrist will review the findings with the patient. So, which is really great because we are able to see patient even if we don't have an optometrist in store. And obviously, we also have optometrists traveling in those markets for in-person exam.
That's fascinating. Like just the expansion of care now to those rural, those underserved areas. That's awesome that you guys are making the shift that direction. I hope we continue to see more of that type of innovation coming out across Canada.
Yes, it's really good. And now at least we can see a lot more patients, so which is super important.
What about in the artificial intelligence space? What are you guys doing, if anything, with AI at this point in time?
So we have the AI-assisted diagnostic implemented in different business units in the company. It basically helps the optometrist to review the health scan for existing health conditions that might not be obvious for initial study of exam results. So we are not doing it yet in New Look, in BC, on Saskatoon, but we are doing it in different business units in the company.
So I can imagine that's going to continue to expand and grow over time.
Yes, I'm sure of that.
I know radiology is definitely starting to become a lot more and more commonly augmented by AI, so it makes sense for optometry scans, also the same thing taking place.
Yes.
What about the actual lenses? You guys are homegrown, made in Canada. How does the manufacturing actually work?
Yeah, so we have a lab in Montreal. So all of the lenses are made in Montreal in Canada, which is super important for us. We are a Canadian company. That with having everything in Montreal, we can be sure of the quality of and accuracy of the prescription. What we do as well, before the lenses or the glasses left the lab, it's checked, and it's checked another time in the store by the opticians. So when we deliver the glasses to the patients, we are 100% sure they are accurate.
What's a lens made of? Are they glass or are they plastic
No,
nowadays?
it's more like sort of plastic, yeah. We don't do a lot of
How do they
anymore.
I'm fascinated by the actual how do they actually make them? I don't know if you know a whole lot about that side of the business. It'd be interesting to hear how the magic is done there.
It's basically you have like a big palette of lenses. You enter everything in the computer, you enter the prescription, everything. And then one of the machine will cut the lens to the prescription. Then that lens will go in another machine to get all the coating, anti-reflective coating, etc. And then that's how it's made. It's a little bit more complex, but I'm just trying to be super easy on this one. We have all the latest machine as well in the labs. That's why we can give good quality lenses, because we always get new machine, new treatment. So it's super important.
Well, I imagine, especially when you're at scale, that probably enables you guys to have the most up-to-date, high-tech machines on the back end, too, the manufacturing side, not just the in-clinic, the diagnostics.
Exactly, and that's what is super important because we are such a big company. We always have the latest technology, even in the lab. So to be able to get the best lenses for our patients.
You guys have quite the remarkable story going from a single location in Quebec to the largest optical group in Canada. What were you guys doing so well that enabled you to grow so quickly and effectively?
So basically what we did is we always wanted to provide the best quality health care. That was from the beginning. And we, for that, obviously, we are having what we say, the most cutting edge technology, and we want the best patient interaction and customer journey. So if the patients are really happy in the store, they will always come back. They will tell their friends, they will tell their families. And that's how you grow a business. It's be a super patient care focus on customer service. And that's how we grow.
The happy customer goes a long way.
Happy customer, it's always good. And we always invest on having new optometrists, developing the best dispensing team. The patient are really well cared of, definitely. Our values are vision, respect, innovation, and passion. So what we want to do is always improve people's vision and move the industry forward. So always getting, like we say before, the best technologies in the lab, in the store for the optometrist, and even in the store for the staff as well. So obviously we want to have always good interaction with the customer and the patient. And we are honest, we are attentive, and we take the time to explain. We spend time with the customer explaining their prescription, explaining our product, and we always try to find the best product suited to their needs.
And then when you have vision as a value to the company, what does that exactly mean? Obviously, I care, but when you break it down, like, I'm sure that means something a little bit deeper to the people in the industry.
Yes, so we always want to aim higher. So we want to develop our staff. We want to have the best optometrists working with us. And we want to have the best customer service in Canada.
And then tell me a little bit more about passion. How does that actually come out from your staff and from your teams? How do you portray that to your patients and clients?
So we are obviously passionate about what we are doing in the store. Optometrists are passionate about their job as well. We really take things to heart, and we always work hard as a team to go further together. And it's like a little making the success as a team. You know what I mean? We want to be successful as a team as well.
And then you guys have been named Canada's best managed company a couple times now. What went into that award?
We've been named one of the Canada best managed company. That's on basically 4 pillars. So the first one is strategy. The second one is capabilities and innovations, culture and commitment, and governance and financials.
And so what all is included under strategy? What does that actually mean then?
So the strategy, basically, new look always aimed higher. So we want to maintain our current position as the larger and best eye care provider in Canada. Obviously, that's super nice. We are using state-of-the-art technology in our stores and in our lab, like we talked about it before. And we are always developing cutting-edge technology for the best care of patients and obviously to deliver the best quality products.
What have you noticed between like 10 years ago or when you started your career to recently? How far has the technology come?
It changed a lot. When I started like 30 years ago, you just had a pen and a ruler to take measurements. And now we are using iPad and latest technology. So it has changed a lot.
Oh, I can only imagine. Yeah, the digital revolution has probably done a ton in terms of your diagnostics.
Yes, definitely. For the optometry and for the opticians.
What about when it comes to work culture? What kind of values and types of people are you looking to hire?
So obviously the culture, it's the main thing. It's the patients care, customer service always. But we always want to hire people actually who are going to fit in the team. It's really important for the dynamic of the team that everybody can work together and everybody will help each other. We always have people even helping other stores sometimes. Work as a team, don't be individual, work as a team. The most important thing is to be part of the team, to be feeling that you are part of the team, you work with your colleague, you help on anything. It's not because you are managers and you are not going to do certain tasks, or it's not because you are an optician that you are not going to do other things. It's really like we need to work all together. We always work as a team, and we always include our optometrists as well. They are a big part of the team, even if they're contractor. It's super important for me to always include optometry. You know, the patient from start to finish is always taken care of.
Could you walk us through a little bit of a typical patient journey for somebody coming into the New Look clinic? How does the team actually support the optometrist in getting that person the care they need?
Yeah, sure. So obviously, the first thing usually, most of the time, it starts by booking an eye exam. So we book an eye exam, we call the patient the day before to confirm. When they come in the clinic, the optometric assistant will check them in. They will perform all the pre-test and they will take the payment. Then obviously, the optometrist will do the eye exam. When the optometrist has explained everything to the patient, they will come in the store, they will explain to the optician. So we always have like a 3-way handover, saying basically we have the doctor, the optician, and the patient. The optometrist will explain the recommendation for the lenses, what do we need to do for that patient. And then the optician will choose the frame and lenses best suited for the patient. We have a manager in every store. We have our opticians in every store. Most of the stores in BC are actually managing optician. So the manager are optician. We also have more optician, obviously. We have an optometric assistant who is really working with the doctor on clinics. So they do everything from the pre-test, the payment, the third-party billing, the record, send the referral. So they really do absolutely everything for the doctors. And then we have eyewear consultant as well, who can choose glasses, lenses, and do the sales. And most of the staff are actually cross-trained. So the optometric assistant can work on the floor, and the eyewear consultant can do the clinic as well.
So if it's a busy day, or if somebody's sick or away for a day, there's not like this giant gap in the team then?
The clinic will always be covered, and the store will be covered, because we just have everybody who can do everything.
What are you guys doing in terms of burnout? Has that been much of an issue for your clinics, for your optometrists? I know that's been rampant, just healthcare in general. Has that affected you guys?
Not really, because we're really working as a team. That's really important to me. So we are all here to help each other. So if it gets really busy at the clinic, someone will help. If we get really busy on the floor, on the optometric assistant, it's free. They will help as well. So we manage to maintain a good balance in the stores. We really try to develop our talents to be the best they can be. We sponsor staff to do the optician course as well. And they can always grow as management. Like I did, I started as an optician within New Look. I became assistant store manager. I became store manager, district manager, and now I am regional manager. So there is a lot of growth within the company, which is fantastic. The good thing is the optometrists will benefit from the staff expertise on the technology used in our store as well. I know exactly what's happening in store. I understand my managers because I have been there for many years. So I think it's really, really important, yes.
Tell us a little bit more about governance and financials. How does that weigh into the picture?
So obviously, due to the strong performance and business practices of the company, the optometrists can be reassured that they will have financial stability and support they need to care for their patients. And that's extremely important at the moment.
And then what about looking 5 to 10 years down the road? What do you see as the biggest opportunities or the challenges for optometrists here in Canada?
I think we have to stay up to date with advanced technology always, because that's what's happening at the moment. And I think the biggest opportunity for optometrists will be to work for an industry leader like us, because optometrists can just focus on the quality of their healthcare. They don't need to be working on financials. They don't have to be worried about the sales. So it's really, really good for them.
Enable them to do what they love and what they're good at.
Exactly. They exactly take care of the patients. I think we provide the best take care, and we are always investing on developing new technology. So optometrists will always have the latest technology in store as well, to be able to do the best eye exams they can and detect, the disease and everything.
I can only imagine it makes a huge difference being equipped with the proper technology versus something older, less adequate.
I was really, really happy to share that. Obviously, we are always looking for optometrists to join us. So it will be really important to just get in touch, and we're looking forward to welcome them in New Look.
And what would be the best way to get a hold of you if somebody is interested?
Probably they can reach myself. I can give you my email address for sure.
Perfect. Okay, we'll put a link to that in the description there.
Perfect.
Awesome. Well, thank you so much, Catherine.
Thank you.